So, okay, I'm going to use this paper to explain. So imagine this is like the external oblique muscle, yeah? So it's like, as the aponeurosis comes, this is the pelvis region. So this is the anterior superior iliac spine, and this is the pubic tubercle. So if that aponeurosis came and inserted on this whole part, there will be no turn for the femoral nerve to pass and the veins for the femoral triangle. So what it does, it comes along, it inserts on the iliac crest, then comes like this and inserts on the pubic tubercle. So if you imagine this is the muscle and it has done this thing that is coming from the anterior superior iliac spine to the pubic tubercle is the inguinal ligament. So the inguinal ligament is formed of the external oblique aponeurosis. You've understood? Eh? So so when it comes, it forms like kind of, just imagine it's like doing this. So this is like the aponeurosis. So this is our inguinal ligament. So right now we already have two borders. So the inguinal canal is like let me show you this. It's like this. Eh? It's like a tunnel, as I told you. So right now we have already formed this border, the floor. We have already formed the floor, as you can see, and we have already formed the anterior border. Okay, the anterior border is like the most lateral one, the one like the most superficial one. As you know, this is a superficial muscle. Yeah. So we have already formed the floor and the anterior border. Then, for the for the posterior border, as you can see, if this is the external oblique, let's imagine this is like the internal oblique and transversus abdominis, and then we have the transversalis fascia. So if it comes like this, it's going to form the posterior border, because if this is anterior, this is posterior. Do I make sense? Yeah. So it's going to form like the posterior border. So we have already formed 3 borders. We're remaining with one. The superior border, the top one. So for the superior border, it's formed by the, sorry, my image covered it. It's formed by the muscle axe of the internal abdominal oblique and the transversus abdominis. Remember, they are the ones in the middle here. Eh? You've understood? Eh? So for them, they don't actually like reach down. They just stop like above and form like the superior border. Is everyone with me? Yeah. So like those are like the borders in summary. So I don't think I'll have to go through those slides. So we have formed our inguinal canal. So most times, okay, the contents vary. It has contents like that pass through it, but they vary from male to female. So females have less contents, so their inguinal canal is normally smaller. For the males, it's normally bigger. So for both sexes, we have the ilioinguinal nerve passing through. We have the genital branch of the genitofemoral nerve, blood vessels, and lymphatics. Yeah. Then for the females, we have the round ligament of the uterus. Then for the males, there's the spermatic cord. So the spermatic cord is covered by the external spermatic fascia. Yeah. Then it has contents. There's a vas deferens. That's like a transport system from the epididymis to the ejaculatory ducts, like prior to ejaculation. Eh? Then we have the genital branch of the genitofemoral nerve. We have the cremasteric artery, the testicular artery, differential arteries. We have testicular nerves, pampiniform plexus, tunica vaginalis, and lymphatic vessels. Yeah? Okay. So I'm going to talk about the rings. So now, for the deep inguinal ring, it's formed by the transversalis fascia. Let me go back to that. this diagram. So it's formed like on the posterior wall. Remember I told the posterior wall is formed by the transversalis fascia. So it's somewhere this side, it's deep. Then it's at the midpoint of the inguinal ligament. So there are these two terms and they are different. Yeah, there's mid-inguinal point and midpoint of the inguinal ligament. Yeah, so mid-inguinal point is between the pubic symphysis, this thing, yeah, and the anterior superior iliac spine. So for it, its use is for femoral pulse. Like when you like touch somewhere in the middle of this, you can feel the femoral pulse. But for the midpoint of the inguinal ligament, it's halfway the inguinal ligament. So from the anterior superior iliac spine to the pubic tubercle. So they are different. So we are saying that the deep inguinal ring is at the midpoint of the inguinal ligament. Yeah. Then it's lateral to the inferior epigastric artery. So it's, yeah, lateral. Then we go to the superficial inguinal ring. This one is within the Hazelbutt's triangle. This triangle is like, how can I say? Okay, like the inferior border of the triangle is the inguinal ligament. Then the lateral border is the inferior epigastric vessel, artery. Yeah? Inferior epigastric artery. Then the medial border is the rectus abdominis. So this ring lies within the triangle. And it's V-shaped and it's formed by the external oblique aponeurosis. That's why it's superficial. Yeah? Then it's superior to the pubic tubercle, so it's around here. Yeah. Next. So I don't know if you can see this, but that's like the ring, but on a cadaver. Yeah. As you can see, the deep inguinal ring is somewhere here. Yeah. Then you can see the inferior epigastric artery is somewhere here, so it's lateral to it. Yeah. Then we have the superficial inguinal ring somewhere here, and you can see it's kind of above the pubic tubercle, which is around here. I think it's not clear because of the lights, but okay. So now, does anyone, okay, let me first finish, then we'll ask the questions. Okay. So now I'm going to talk about hernias. Yeah. So hernia is a protrusion of abdominal content through an area of weakness or defect along the abdominal wall. It's like a protrusion. I'm going to show you. So it can be congenital or acquired. Yeah. Most of them are acquired with age. Yeah, as you grow old. So we have types of hernias. We have the direct hernias and the indirect hernias. So for the direct hernias, they result from weakening of the transversalis fascia. Yeah. Then they are medial to the inferior epigastric artery. Yeah. Then they are increased. I mean, there's increased tendency with age because as you go, like your tissues are growing old and everything. Then they are less susceptible to strangulation. Okay. Strangulation is like when your hernia, like maybe compresses an artery, and like there's no blood flow to a certain organ or tissue. You understand? So that's strangulation. So the fact that these direct hernias are normally kind of wide, they are not enclosed in a tunnel or something. They don't normally cause strangulation and everything. So they're called incarcerated hernias. They don't, sometimes, okay, most times they don't cause strangulation. Then we have indirect hernias. Those are the ones that pass through the deep inguinal ring. So it's like maybe, let me say, an intestine. It can pass through like the ring and continue going. It can even pass through to the superficial ring, go to the scrotum in male. Yeah. So there are some signs and symptoms, and they cut across most of the hernias. So there's like a